Hello and Assalamualaikum. Our group will talk about what is art. Art stands for Assisted Reproductive Technology, and it is used to achieve pregnancy in procedure such as fertility medication, artificial insemination, and embryo transfer. The reproductive performance of farm animals impacts the profitability and degree of genetic improvement accomplished. Genetic improvement on the male or female side influences reproductive performance. As a result, ART is employed to produce a superior offspring. Now we are moving to one of the example of ART, which is embryo transfer. Embryo transfer in livestock is an artificial method of breeding whereby newly formed embryos prior to implantation are removed from a female animal and is transferred into the reproductive tract of another female of the same species where they develop to term. The figure on the right shows the brief process of embryo transfer. Let's take a look at the background of the first embryo transfer. The first embryo transfer was performed and recorded by Walter Heap in 1890. Walter Heap is a British zoologist and embryologist. How this is worked? He transferred 2 Angora rabbit embryos into a gestating Belgian does. The Belgian does produced a mixed litter of Belgian and Angora bunnies. The picture shows the illustration of how the embryo transfer between Angora rabbit and Belgian does is produced. Next, we are going to move to the objectives of the embryo transfer. The first one is to obtain desirable genes. Embryo transfer is used to disseminate desirable genes from superior female animals from various species. Second one is to multiply genetics. Embryo transfer used to amplify reproductive rates of valuable females due to low production rates and long generation interval. And the last one is to overcome hybridization barrier. Embryo transfer allows the breeding of incompatible interspecific and intergenerate species and help to overcome the hybridization barrier.
Now, I will explain about features characteristic of the donor for embryo transfer. The perfect donor female is free of reproductive disorder and disease, has had regular estrous cycle starting at a young age, regularly conceive with no more than 2 inseminations, maintains a 365-day or less calving interval, and calve without trouble. She is also without conformational or no genetic flaws. The productivity of these female as embryo donors depends on effective dietary management. This entails maintaining a healthy weight and giving the body right nutrition, which include mineral crucial to reproduction. The features characteristic of the donor for embryo transfer also including genetic selection, which cattle breeders can increase selection power by utilizing genetic statistics that incorporate production data, not only for the individual in questions, but also production data from its offspring, ancestor, siblings, and other relatives. The second one is phenotypic selection. The donor selection can be based on several types and production traits. The type traits can include general conformation, proportion, height, mature body width, scrotal circumference, other type, pelvic measurement, and carcass trait such rib-eye cross-section area, marbling, back fat thickness, and yield grade or percent retail product. The last one is the donor reproductive status. It must be examined and in good condition, which do not have any defect such as urine pooling, short cervix, excessively long vagina, or deep uterus that may affect fertility.
Alright, now we move to the procedures of embryo transfer. The first step is to select a donor cow. The potential donor cow should be reproductively sound to produce maximal results. This means that the cow should have a normal reproductive tract on rectal palpation and have a normal postpartum history, especially with regard to cycle length of 18 to 24 days. The cow should be maintained at the level of nutrition appropriate for their size and level of milk production. If the cow is too big or too thin, they will reduce fertility, so it is important that the donor cow be in appropriate body condition score at the time of embryo transfer. Superovulation of the cow is the next step in the embryo transfer process. It is the release of multiple eggs during a single uterus. With an average of 5 transferable embryos, 85% of all normally viable donors react to superovulation treatment. The basic concept behind superovulation is to use a hormone preparation with follicle-stimulating hormone activity to encourage substantial follicular growth. On the third day of the treatment, a prostaglandin injection is administered. This will result in corpus luteum regression and a heat or uterus after 48 to 60 hours. Next is the insemination of the cow. The superovulated cow will be inseminated by embryo transfer specialist multiple times during and following uterus. In any embryo transfer program, having high quality semen with a high percentage of normal motile cells is essential. The uterus body directly in front of the cervix is the proper location for semen implantation. Inseminators have a propensity to insert the rod too deeply, depositing the semen into one of the uterine horns and lowering fertility. Next step is the flushing of embryos. The most crucial part is that the donor cow's cervix is punctured with a synthetic rubber catheter and that a specific medium is pushed into and out of the uterus. The lumen is filled with a pre-sterilized stylet and a Y connector with inflow and outflow tubes is then attached. The embryos are flushed out into a graduated cylinder as the fluid is added and subtracted by gravity. Next step is the evaluation of the embryos. They are evaluated for their quality and classified numerically as the potential likelihood of success if transferred to a recipient female. The criteria are regularity of shape of the embryo, compactness of blastometers, variation in cell size, colors and texture of the cytoplasm, overall diameter of the embryo, presence of extruded cells, regularity of the zona pellucida, and presence of vesicles. And then the selection and preparation of recipient females. Proper recipient herd management is essential for successful embryo transfer. To maximize embryo survival, conditions in the recipient reproductive tract should be closely resemble those in the donor. This requires synchronization of the uterus cycles between the donor and the recipients, optimally within 1 day of each other. The cyclomate B system involves injecting the recipients and implanting them with a synthetic progesterone, which is removed 9 days after its insertion, and the cows will show standing uterus approximately 30 to 40 hours later. Synchronizing drugs are only effective on recipient females that are already cycling. The last step is the transfer of the embryos. Transferring an embryo into a recipient cow involves loading it into a 1/4 ml insemination straw, requiring practice, patience, and skills. Degenerated or low-grade embryos will be discarded. The recipient's ovaries are palpated, and then the transfer gun or insemination rod is passed through the cervix. The embryo is gently expelled, avoiding damage to the uterus lining. Embryos can be transferred immediately or stored in liquid nitrogen for later use.
There are many advantages offered by the embryo transfer technology, and one of it is it increases the productivity. For example, cows or heifers properly treated can release as many as 10 or more viable egg or ova cells at one estrus. Approximately 85% of all normal fertile donors will respond to superovulation treatment with an average of 5 transferable embryos. Furthermore, embryo transfer technology makes import and export easier because it is done in the form of embryo, in which transportation is easier, genetics is diversified, and cost is decreased. This program also requires less transport of live animals from a place to another, thereby reducing risk of disease transmission. In addition to that, import and export of these small live embryos makes it easier and allow more rapid exchange of genetic material between countries. Next, on behalf of environmental advantage in embryo transfer, passive immunity is passed on by the native dam, giving the offspring a better chance of survival despite the embryo being 100% genetically different from the surrogate mother. Last but not least, this program gives benefits on financial factors. Once the desired genetic impact is realized, the production of milk and beef will improve in reaching a point of highest development of the production to increase the income. In well-established enterprises, one can also manage in selling the embryos as additional income. Embryos can also be stored indefinitely through freezing, thus making the highly superior genetic material available for future use. Next, on the disadvantage of embryo transfer technology, we have technical specificity. The technology requires trained technical personnel and a high level of management. It needs technical knowledge, especially in relation to flushing the embryos and observation of estrus in the recipient female. The detection of estrus and synchronization of recipient with donor is also a difficult step and must be handled carefully. The cost of the actual embryo transfer services or technology may be quite low. However, labor and feed cost average over the number of offspring produced are high, since normal and healthy dams are kept out of production in order to be available as recipients. Although embryo transfer is generally costly, it is frequently still profitable. Finally, embryo transfer also causes low success rate. The success rate of embryo transfer is reportedly lower than use of artificial insemination. This may be associated to the numerous processes that have to be managed before the embryo is successfully implanted. This being a labor-intensive and time-consuming technology, it may be wise that farmers must weigh their options and understand their abilities and goals before practicing embryo transfer technology.